Many thanks. Good afternoon, rather. My name is Joy Gitaka. I'm the coordinator at Business Ireland, Kenya. Africa Health Business is one of our corporate members, one of our esteemed corporate members. Business Ireland, Kenya essentially is the Irish business chamber here in Kenya. We work, of course, to support trade and investment between Kenya and Ireland, with healthcare being one of our many major themes that we focus on. So I'm very, very glad to be here and quite keen to, hear more about the session and of course, attend the session that's coming up next week as well.
Fantastic. Thank you. Reshma, over to you. Introduce yourself.
Yeah, hi everyone. I'm Reshma Patil and I'm representing Bharat Serums and Vaccines along with Prashant Kumar. We are very much interested to collaborate with the African Health Business Symposium on improving the women's health. What is the role of the private sector?
Thank you. And Silas, I'm keeping you as long as, and when Dr. Benjamin is already with us, I would like you to let me know. Thank you, Silas. And you've been really, really great for this media briefing because the word today is going to spread in Africa and beyond thanks to the team at Africa CDC. I also want to thank the partners who are with us. Let me ask Julie and then Pamela to just say hello to us and introduce themselves. Julie, you want to go first? Pamela, do you want to go? If you can unmute.
Good morning, everybody. I'm Pamela Koumba. I'm a journalist from SABC Channel Africa, based in Johannesburg. Thank you.
Thank you, Pamela. We want you to get the word out there. We want women to get better health. Charles Kamau, over to you before Winston comes in.
Thank you very much, Amit. My name is Charles Kamau. I'm the project lead for the Coalition of Blood for Africa. Very happy to partner with AHBA and on the sidelines of the AHBS who will be running a breakfast session, particularly centering the importance of adequate, safe and sustainable blood towards mitigating PPH, which is, again, as we know, major mortality cause for women in sub-Saharan Africa. So happy to be here and being part of spreading the good word about such discourse. Thank you, Amit.
Thank you. Blood is important. Happy to have you here. Winston, before I go to Emma and then Ravi. Winston, you want to say hello? Winston or Julie, if you're part of the media or journalistic.
Yes, sorry, it was on mute. My name is Julie and I work for Organon at the Global Public Policy Department. And I am very happy to be here with all of you.
Thank you, Julie. Organon is into lots of contraceptives and women health products. We want to hear more during that day. So thank you.
Thank you.
Winston, if you can come on stage and just say hello, or we move to Emma. Emma, Waiyaiya. Emma, are you with us?
Yes, I'm here. Good afternoon, everybody. My name is Dr. Emma Waiyaiya from Farm Access Foundation, Mom Care. We're very happy to be here and very happy to be promoting women's health. Thank you.
Thank you, Emma. Ravi, you want to say hello before I go to Ida? Ravi, okay. Ida Mbuthia, and then Dr. Zain.
Good afternoon, everyone. My name is Dr. Ida Mbuthia. I work with Roche as the medical affairs lead for the diagnostics arm of the business, and happy to be collaborating for this year's summit. Thanks.
Hi, Ravi here. Myself, Dr. Ravi Gawali from Bharat Serums and Vaccines Limited. Very happy to collaborate with AHBS for upcoming activities, and we are in women's healthcare. So looking forward for a wonderful collaboration. Thanks.
Thank you. Thank you, Ida from Roche. Thank you, Ravi from Bharat Serum. Vaccines are important. Our partnership with India and Africa is also quite important. Happy to see you guys. Zain Siddiqui, you're on here.
Yes. Yeah, hello everyone. So I am part of Dr. Ravi's team from BSVL. I'm the senior medical advisor from the medical affairs team. Hello to everyone. Good afternoon.
Hello, Eric Wahoo, welcome. And then Vivian. Eric, are you with us? We can't hear you, Eric. Can you hear us? Check your audio. And I want to move to vivienwamalwa. Hi, Vivian.
Hi, Dr. Amit. My name is vivienwamalwa. I'm the growth manager from Bionate, and I'm excited to be part of this congregation for the symposium with the AHB.
Right.
Thank you.
Teleconnection, telehealth, Bionate, women's health. Great. Bring healthcare closer to the people. Eric, are you back? Eric Wahoo, we still can't hear you. Stephen Maina, you want to say hello?
Hi, good afternoon. Stephen Maina from Roche as medical value partner. We partner with HBS at this upcoming symposium. Thanks a lot and looking forward to a successful meeting.
Roche will always remember you. 2 years ago, you guys brought some quick tests for COVID-19 using your Cobus machine. And of course, you do much more. So welcome as a partner. There's somebody called CSRG here. I'm not sure. Silas, is that part of your team? I'm not sure. But CSRG, if you want to introduce yourself, that's great. Silas, I'm going to get back to you. And I would like to ask Dr. Benjamin, who is actually our lead and our lead partner and the leadership from Africa CDC, to greet everybody here before we plan to speak at the official press briefing. Dr. Benjamin, welcome. The floor is yours. Silas, are you with us? Okay. That's fine. I think we definitely want Dr. Benjamin to come on this platform before we begin. I've got also many other partners here. Frank Loeffler, you want to say hello to us?
Hello, Amit. Thank you for inviting us. And I'm part of the Roche team, General Manager for East Africa. And we are very happy to be with all of you, not only today, but also for next week's conference. And we're very much looking forward to the discussions. Thank you so much.
Excellent. I remember, Frank, you were one of the first ones when we were planning this about women's health. So among the first ones to support us. Thank you for being here. I would like to ask Delft Imaging. I think you guys are dialing in from Netherlands. Would you like to say hello?
Hi, yes, we are joining you from the Netherlands. Hi, everybody. My name is Enya, and I'll be coming to Nairobi for the event later this month. Looking forward to meeting some of you. So Delft Imaging, we do innovative medical imaging focused on low resource settings. And at this specific event, we'll be presenting our newest innovation called Baby Checker, which is a AI-powered ultrasound device to make pregnancies safer.
How wonderful is that? And we welcome you to Africa and Kenya. Enjoy your trip. Have a safe travel. Let me invite Francis Juma. You're writing a lot on the health news in Africa, Francis. Are you on here with us? Can you hear us? Can you introduce yourself?
Yes, I can hear you. I'm just walking into the meeting and I was rushing to the office. Yeah, my name is Francis Juma. We publish Healthcare Africa magazine and website. These are fairly new for those in the healthcare industry, but we have about 8 years of writing magazines that go into the B2B space in Africa, whether it's in the food industry or in the general business area. And we're quite glad to be part of this event as we get to interact and get to know more about the opportunities and challenges in the healthcare sector in Africa. So if you want to reach out to us, healthcareafrica.info. That's where you'll get us. Thank you.
And spread the word. Today, it's like we are making an announcement. We're talking about something. So Francis, please tell the others what's happening. Can I also now invite Ben Abdallah Imene, if you'd like to say hello?
Yeah, hello everyone. I'm Imam Ben Abdallah, also part of Roche team. Happy to be with you today and looking forward to the meeting next week.
Are you traveling into?
Yeah.
Safe travels. Hoping to see you soon. Let me invite Jacqueline Karachi from Biomerieux to say hello.
Hello, good afternoon, everyone. My name is Jackie Karachi, a business manager for Biomerieux based out of Nairobi. Biomerieux is a global IVD company, so we focus on laboratory diagnostics, and we have a portfolio that also supports women's health. And I'm looking forward to the discussions and to meeting all of you. Thank you.
Lovely to see you, Jacqueline. Dr. Benjamin, I want to give you a warm welcome as the lead from Africa CDC. I want to tell you that a few minutes ago when we started, we were doing a few introductions of the media and journalist team here. Also, a lot of partners from within Africa and outside who are friends of Africa and are going to be very pertinent to this women's health movement. I haven't been able to ask everyone to introduce themselves, but if anyone has any questions or wants to raise their hand, this is an open forum, and I would like to have first the opening remarks and welcome by Dr. Benjamin, if we are ready to go, and then we'll go through the session. Benjamin, welcome.
Recording in progress.
Thank you very much, Amit, and it is a pleasure to be here. Let me welcome all the press members here, partners, friends, everybody. You are welcome to this major briefing session, and you are free to ask any question here, and looking forward to see you all in Nairobi next week. So let me just stop there since the time is of essence. I don't need to talk too much. I just want to say thank you to AHB and its leadership for making this happen, and also to thank the official partner, which is the Ministry of Health of the Republic of Kenya. Thank you.
Benjamin, I'm looking forward to hosting. Many of the partners are looking forward to meeting you in person. And as Africa CDC, you make us proud. You are 5 years old, but at the age of 5, you're moving mountains. And all of us wish you all the best. Let me also thank Silas. Silas and Gwen from your team at Africa CDC, you put it together. Can I also thank Kaushal and her entire marketing and comms team at AHB, and Daniella for making this through. We have 3 parts at this media briefing. One will be by AHB, the second will be by Africa CDC, and the other will be by Ministry of Health. The agenda is here, and I would like to officially begin by welcoming everyone to this media briefing and talk to you on what kind of information we'll capture through. Next slide, please. Africa Health Business is headquartered in Kenya, but work around 27 countries in Africa. Our intention is, through being a catalyst and a facilitator, drive greater investments and partnerships in healthcare to improve lives and livelihoods. Through many partners here today, our work is made possible. And through many partners here today, we're building trust between government agencies and the private sector. This is a fundamental piece for us to move to the new public health order that Dr. Benjamin will talk to you more about when he talks about the new Africa movement. Next slide. One of the things that is necessary in health to do this appropriately is convening and getting together. You do it in your own companies. We do it in our own countries. But through the events that we in Africa Health Business have been able to organize, our reach has started growing, not only in Africa, but beyond Africa, with a broad spectrum of leaders who make the difference in policy, and we see implementation on the ground. Next. So at this particular event, if you look at the timeline, we have been through these few years across from the 2016 to 2022. That's why this is the 7th edition. These editions have created a movement of close to 50,000 people in the healthcare industry that are now part and parcel of our database and movement. Many of you receive our newsletters, get our communication. Feel free to ask your members to sign up. It's at absolutely no cost. And this is the 7th hybrid session that we are holding in Nairobi. And we are extremely delighted that the theme that was suggested by many of you was women's health. And that's why we are moving to make this a hybrid session on women's health that will be taking place on 24th February at the Trademark Hotel. Not all of you may be able to attend in person, so the free link will be available. Our official partners for this event are the Ministry of Health in Kenya as the hosting ministry, the Africa Union, together with Africa CDC, leading the technical side of what the new public health order will look like. And on the next slide, I'll quickly take you through the agenda for the day as we look at the endorsements that have come through WHO and also through Africa CDC. You can see that women's health is at the center point of health. And WHO is fully committed in improving women's health across Africa. Dr. Tedros has been a great supporter of public-private partnership, and so has CDC. And today is a testament of our togetherness that will drive healthcare agenda to the next level. Next slide. This is what the day will look like. This is what the day will look like. And the thematic breakfast session, together with the opening ceremony, will set the stage. We will have a little bit about the cancer and the threat for women. We will talk about the Kenya Health session, an investment opportunity session at lunchtime. On session 2, we will talk about the reproductive maternal child health. Session 3 will be about improving health and well-being in Africa under the UHC umbrella. And finally, we will talk about leadership in advancing women's health on the continent. Not only will we recognize the leaders, but we'll talk about what leadership requires us to do to make the true healthcare shift on self-sufficiency in Africa. And the closing ceremony will then wrap up the session for the day. Next slide. Yeah. On the margins of this, we will also be talking about specific topics. And look at the topics on your screen. On the first day, we will talk about barriers to care throughout the women's cancer journey. We will also have, that's Roche, and Revital will be leading the affordable healthcare through quality local production. On the 24th itself, Koba will be talking about the role of blood. And we know, all of us know about the postpartum hemorrhage and the blood loss. Hologic will be leading integration of women's health into universal health coverage, a pathway to a healthy future for women and economies. At the lunch session, we will be opening up a complete new horizon for the opportunities for health in Kenya, led by the Ministry of Health, Vision 2030 and Ken Invest. It'll give you a glimpse into what's happening in a hosting country, which is what we do every time we take this business convention to different countries. GE Healthcare will be talking about transforming healthcare through advanced innovations in Africa. And then we have Connexi, who will be talking about technology-based solutions for the last mile delivery, which is a branch, a subsidiary of Chemonics. And finally, the second dinner session will be led by Organon, United for Women's Health in Africa. Next slide. These are the kind of program that we'll have for the day. This is the kind of sessions that we will be working through on the 24th of February. I'm hoping that the networking, the engagement between ourselves, both from the public and private sector, will get the process moving in the right direction. The opening ceremony, which will be led by our official partners and partners from the private sector, will provide a good mix of how we can work together. The first 4 speakers will be bringing in the private perspective, private sector lens perspective on greater investments and greater collaboration and the whole lens on women's health, led by Tanya, Alan Pamba, Abafole, and Carol Karyuki. We will then have Africa CDC, East Africa Regional Coordinator, Dr. Achamlesh Debela, followed by Dr. Moeti, who is the Regional Director of WHO. And then we will have Honorable Kagwe, who is the Minister for Health, the Cabinet Secretary. And then finally, together with him, we will have an official opening jointly done by Her Excellency Margaret Kenyatta, the First Lady, Government of Kenya. Those of you who don't know the work she does, she's been quite a champion in women's health across the country and has got great initiatives, including Beyond Zero, that have touched many lives. Next slide. To the media and all the partners, the interest about women's health has grown tremendously. We have 1,164 registrations. We have 117 person, 49 VIPs. This hybrid conference has attracted close to 80 countries who are participating. And you can see the 41 countries on the left from Africa that will be joining us either in person or online. Next slide. I want to thank these partners. They have been instrumental in the way we've been able to rally support, to have lots of people participate. But more importantly, I really want to see that there is a clarion call from all these partners that women's health matters. Because it matters, they want to change policy. They want to make a difference towards the new public health order. So Dr. Benjamin, in front here, you have just a display of some of the private sector organizations that have raised their hand and say women's health matters, and we will walk the journey together. Next. Our strategic partners who've used their own members and countries across the globe have continuously supported us. And I want to thank the United Nations, who have the SDG Partnership Platform, who's headquartered in Nairobi, and the regional team lead will be present at our event. I'm delighted that Business Island, American Chamber, Africa Healthcare Federation, Kenya Private Sector Alliance, and all the others that you see from South Africa, Zimbabwe, and Morocco, North Africa are all here as partners. Next slide. That gives you a glimpse of where we are. And I'd like Dr. Daniella Munene to now give us a short brief of the main concerns for women, as we then bring in Dr. Benjamin to frame up the Africa CDC intervention. Daniella, over to you.
Thanks, Dr. Amit. So what are we talking about in this full day hybrid conference and the side sessions? We're going to be focusing on the following main concerns for women's health in Africa. One is the cancer burden, and breast cancer and cervical cancer collectively form the biggest cancer risk for women in general, and more so for women in Africa. And we're going to have a session where we unpack how we can put in place policies and partnerships to reduce this cancer threat. We have breast cancer deaths in the region having increased by 70% since the year 2000, and we want to reverse the direction of these statistics. The other main concern is reproductive and maternal health. Approximately 300,000 women die from pregnancy-related causes every year, and a huge proportion of these deaths is in sub-Saharan Africa. So we have a whole 1.5-hour sessions on reproductive, maternal, and child health, where leading voices from private sector are going to share their strategies and thoughts about how we can entrench RMNCH within UHC frameworks and reach every last woman on this continent with affordable and quality reproductive health services. The other concern we will focus on in the conference is availing universal health care for all, having an integrated comprehensive care from birth to old age. And so we have a session titled UHC. And last but not least, we want to recognize African leaders who are advancing women's health on the continent. So we will have a spotlight session just to show what leaders across the continent are doing to advance women's health in Africa. And so this is really what comprises all the discussions the entire day. And we're looking forward to have very, very insightful conversations. Thank you.
Thank you, Daniella. And I would like to now move to, I know Dr. Lenai has gone with the Kenyan delegation to Dubai and is attending the expo right now. And I am not sure if I have the Ministry of Health available on the call here today. If anyone from the ministry is here, please raise up your hand. They might join us later. If I don't have the ministry represented, I really want to warmly welcome Africa CDC, and I want to invite Dr. Benjamin, who is the head of policy, health diplomacy, and communication at Africa CDC to guide us and lead us into this new process. Dr. Benjamin, warm welcome.
Thank you very much, Amit, and thank you really for associating once again Africa CDC in this journey. As you know, Africa Centers for Disease Control and Prevention is the public health institution of the African Union, and the agency has been upgraded recently during the last summit by the head of the government has the African Union Agency on Health. So we are now having an expanded mandate across the continent. So now coming back to really the role that we are going to play in this woman health, we know that the majority of the population of this continent is composed of women and children, and the human health is extreme for us. And we have identified some of the challenges that we need really to overcome. And we hope that all these issues will be addressed through the program that you displayed earlier. For us, you know, African women bear an unacceptable huge burden of disease and death on the continent. If you look at the maternal mortality ratio in some countries, it is just unacceptable. The second issue for us is the underinvestment in women's health care. That is one of the many challenges that we need also to overcome. The other issue is that this needs to be approached as a multi-sectoral approach, which is imperative for women health. We also noted that women's socioeconomic empowerment is essential to achieve better health. The violence against women is also unacceptable. So these are the issues that we have identified as Africa CDC, and we are trying to respond through what you mentioned as the new public health order. If you allow me to share my screen quickly, I just want to show you just one slide to explain what is really the new public health order for Africa. Okay, so I just want to quickly do this. The host, can you allow me quickly to share my screen? I am still unable to do it. Great. Can you see my screen?
Yes, very clearly, Dr. Benjamin. Thank you.
So now, what is the public health, the new public health order for Africa? We have several components. First, we need to strengthen the Africa CDC and the national public health institutions across the continent. The second aspect, we need to expand manufacturing of vaccines, diagnostics, and therapeutic. As you all know, the imported vaccines and medicines today constitute the majority rather than the local manufacturing on the continent. We also need an investment in the public health workforce and the leadership program. And there is a huge gap in terms of human resource on the continent. And we need a respectful, action-oriented partnership. That is why we are joining AHB today for this event. So we need public, private, all the scientific societies, academia, civil society, everybody. We need inclusiveness, and this all constitute, the new public health order for Africa. And one of the enablers that we see is really the domestic finance, the financial resource for health. Extremely important. Head of state and government have decided in 2001 to allocate 50% of the national budget to health, but this is not happening. We have about 6 countries that have met the target today. So we have a lot of work in our hands to reach that level. So Amit, let me just stop it here, and we can come back when there will be the question session. Over.
This is so good. Thank you for sharing the 4 pillars of the new public health order. I am sure many people on this call appreciate the framing of the new public health order. It's still new, launched in December, and through partnerships, I think we can achieve greater results. I would like to ask the members of the press, members of the partners who are here, corporates, international organizations, to please feel free to ask any questions and clarifications that you may have. Anyone who would like to go first, usually those are the ones that come with a bit of like, should I go first or not? So let's have any questions or queries or comments that you have to the partners that we have here. Right. I know that somebody was responding. Abdi Mustafa, would you like to say something? I know you wanted to say you might have a question or a comment. What information do I need to provide on the travel health questionnaire? Kaushal, do you want to say if there was some information? I don't know whether the portal, I think every country has a different kind of regulation on travel, if that is your question. Yeah, go ahead.
Hi, Abdi. Pooja from our team would have sent over any information. And if this changes, she will send over updated information as well about your travel into Kenya.
Could you share an email to Abdi and everybody here, should they have a query about Kenyan regulations and Kenyan travel and Kenyan visa, so that nobody gets stuck in between? And also, if there are any requirements when they're leaving Kenya.
Yes.
We also are very happy that the ministries and delegates from different countries will be coming. The Minister for Health, Ethiopia, Benjamin, is also going to be with us. We have the Minister from Nigeria. We also have the Africa Medical Agency Special Envoy to AU that will be with us. Fortunately, people are making effort to travel, which is very different from what it used to be last year and the year before. But you never know what does come in between when travel plans are made. Daniella, would you like to add anything to the process? It seems like the media briefing has been quite clear. You and Silas should come in.
Nothing to add, just looking forward to meeting either online or physically at the event.
Silas, from the Africa CDC media perspective, are there any other points or comments you'd like to make? Kaushal, could you speak about the live stream YouTube management for everyone who might want to send this across, beam it?
Yes, so this whole event will be live streamed on our YouTube channel. And on the day, we'll also be tweeting from our handles links to our YouTube channel.
Thank you, Kaushal. Dr. Benjamin, there's a question on the chat box from Pamela. Since the launch of the order, are you getting some countries ratifying it? And I don't think it's very similar to AMA, where there is ratification needed. What is the buy-in of the countries and how are they going to get involved?
No, the new public health order is not a program that needs something that needs the ratification of the member states. Is a philosophical approach of the public health arena on the continent, the change that we want to see on the continent. So the continent, the countries in Africa are aware of all the challenges that we are having. If you take the workforce, for instance, for the continent, and if you take cadres like epidemiologists, a continent of 1.3 billion or 1.2 billion, between 1.2 or 1.3 billion, Africa today, we have, if we take into account what WHO says that we need, for instance, one epidemiologist for 200,000 population, it means that we need something about 4,000 to 5,000 epidemiologists on the continent. Today, if you look the landscape on the continent, you have only, barely 1,800 epidemiologists for this continent of 1.3 billion people. So there is a gap. There is a huge gap that we need really to close. That is the new public health order. So we need to come all together, the different pillars like partnership, academia, everybody. We need to come together. How are we going to fast track, the trainings of the epidemiologists to close the gap? That is the new public health order. The second, I can mention also the vaccine manufacturing or the diagnostics manufacturing, whatever on the continent. It is extremely important. Member states cannot do it alone. They have to go, with partnership. If we want to establish a manufacturing unit for diagnostics, for instance, on the continent, like in Africa, we are having HIV for the last 40 years, but there is no single diagnostic that is produced on the continent for HIV, for instance, just the rapid test. We are importing millions and millions of diagnostics kits every year. So these are the kind of the gaps that we need to close. So that is the new public health order. And the new public health order for us is, we were re-emphasizing it for so long. The first concept, we wrote a comment on the Lancet Global Health in 2017. Dr. John, myself, and Ambassador Maegun, framing the new public health order in the Lancet Global Health in November 2017. So that it is a philosophical approach of what we see and what we want to see happening on the continent in terms of public health. Thank you.
So Pamela, here you have your answer. And I'm hearing the human resources is a big issue, getting the right stuff. I'm also hearing that manufacturing and being self-sufficient, like Benjamin mentioned, diagnostics. We are importing all the HIV testing, and we've had it for what, over 17, 20 years on the continent. And I'm glad that we also have partners like BSV, Bharat Serum Vaccines, who could do technology transfer, and many other diagnostics and pharmaceutical companies. Let's make it in Africa for Africa where possible. That's being transformed. I knew that we were going to get something on COVID. So Dr. Benjamin, this question about COVID-19 vaccines and rollout, we've done so much. Besides COVAX, we did AVAT. And AVAT brought in a new layer of protecting people in Africa. We haven't really vaccinated as much. What do you think we need to do to roll out more COVID-19 vaccines across the continent? We are not out of the woods.
No, we are not. And we don't want to see, COVID-19 becoming an endemic on the continent. The other regions of the world are getting out gradually because they have massively vaccinated their populations. So today, as we are speaking, we have only 11% of the African population that has been, fully vaccinated. So that is a big gap. And for us, we wanted to immunize at least 70% of the population of the continent by end of 2022. So many things are happening. And now the vaccines are becoming more and more available. And the challenge that we are facing is in the side of the vaccine rollout. There is a lot of resistance, for the vaccine uptake at individual level because of the misinformation, because of the infodemy that is going rampant on the continent. And my team is really busy, coming up with some different type of campaigns that we are rolling out on the continent to really reassure the population of this continent that the vaccines are safe and they prevent really, people to get severe COVID-19. So that is the only way that we can really get rid of this COVID-19. It's extremely important, and we are working. Yesterday, we were brainstorming with the youth division of the African Union Commission. We know that the majority of the population of this continent, more than half, is below 35, and we need to get them on board. And now we are designing a specific program, really, to bring young people on board to increase. Will be launched very soon by His Excellency President Cyril Ramaphosa, who is the COVID-19 champion for the continent. We have seen that if we want to reach the target of 70%, really, we need to get young people, vaccinated. Thank you.
Very clear. One more question has come through on the chat box, really about the change that we want to see. So we've got from Organon, Mokadi is writing to us from South Africa. Mokadi, thank you. You fully support Dr. Benjamin's call, and you are one of the organizations we are counting on. Budget cuts. I don't know, do we need more, Benjamin, do we need more money for health in Africa, or do we need more health for the money? Somebody is worried about budget cuts and dragging feet on public health reforms. What's your view on that?
There was a very interesting report that was launched by WHO in 2010, on the status of health financing in Africa, and it was done jointly by WHO and the value for money report. More money for health, or more health for the money that is being invested. We don't need to see really, investing in health is investing in social development, really. And the return on investment is just simply huge. When you increase if you increase your domestic financing, on health by 5%, you increase, I think, 2 or 3 times, the increase in terms of the GDP in the country. So it is extremely important. We should look at it like this. But the challenge at country levels, there are many challenges. Okay, you can invest, but you need to have a strong accountability, really system and measures in place. That the money that is supposed to go for procurement is not being directed somewhere else. Extremely important. So we need to be accountable for the resources that already we have. But as I mentioned to you, there is a lot of gaps on the continent, and we need to close these gaps. Just in the side of the manufacturing. And I am not advocating for each country should have a factory or plant to produce anything on the continent. For us, we see it. We need to regionalize. We need to have a strong hubs for vaccine manufacturing, for commodities, etc., etc. For instance, if there is a strong plant that is producing this type of medical product in Kenya, I think we need to tap into the regional market rather than trying to put it in Uganda, in Ethiopia, etc., in Tanzania. So that is how the approach that we are advocating for, and we don't want to see a segmented market. We need to see an integrated market, and today we can thanks the Africa Free Continental Trade Area that is here is an opportunity for the countries really to seize and increase the production and the exchanges between the African countries. Thank you.
Very clear. I think that answers that question. We have one question talking about the CAB-LA HIV prevention injection. It's a bit technical, but I don't know, Benjamin, this injection, he's talking about South Africa before the end of 2021. Any insight on that injection?
I am not aware of it, so let me not comment on the information that I don't have, but I promise that I'm going back to look for the information. I left the field of HIV a couple of years ago now, so I am not really aware of what is going on in the Africa in the HIV prevention area, but I will look for the information. And
Abdi, you've thrown us a curveball. It's like a big technical question. I wonder if you want to talk about it, you can take a minute or so. But before that, let me get to Jacqueline Karachi, who also talks about financing, talking about insurance and public insurance. I think, Benjamin, the idea is that many countries in Africa are getting a national insurance fund, Rwanda, Ghana, Kenya, others. And if they run the fund well, it should bridge the financing gap, less out-of-pocket expenses. But it's not growing to the scale that we want. And also, I think there are lots and lots of exclusions. Even diagnostic services might be an issue. What's your view about that?
No, we did, when it's come to health, really, no one should be left behind. Extremely important. And what we are seeing now with the different schemes that are available across the continent, there are some countries that are ahead of time. Countries like Rwanda, Ghana are doing extremely well. And we really need to share their experience with the other countries on the continent, because, people, those who are financially well are also protecting the others. And that we need to bring that spirit of solidarity, to play. Extremely important. And we cannot leave the issue of the insurance only to the government. That is where the private sector is key here. We need to bring the private sector, we need to bring communities. So there are different levels of health insurances that we can implement. It will be difficult to implement it nationwide, but we need to find some specificities. Those who are working can cover, those who really are not working, etc. So there are some mechanisms that we can bring into play. Thank you.
That's your answer, Jacqueline. We will have NHIF in the house next week, and they will be speaking at the UHC forum. So stay tuned. Krupali is one of the manufacturers in Kenya that has been supplying WHO with syringes. They made us proud with a factory based in Kilifi. She's ready to support. I think one question, Benjamin, that comes out from many local manufacturers in Africa is advanced market commitment. And as an investor, when you put in a lot of investments and you don't get advanced market commitment, and there's a good balance on what you should bring from outside and what you can buy from within, that might be also a challenge. What's your response on that?
Yeah, no, that is a real challenge, you know, especially in Africa here. And the advanced market commitment, that is why I'm saying that, you know, these local producers should target regional markets on the continent, not only, you know, within the country. If, you know, our countries are very small, really. If you want to do something just for your country, we need to target, you know, the regional market. And that is why is being established to address all these issues. There is the issue of you know, this national regulatory that is registered in a country A. It is not easy to register in country B. So this harmonization work needs to be done so that there can be, we can have this you know, economy of scale, and this advanced commitment can be done. And this is a decision that can be taken and facilitated, you know, at the continental level by the African Medicine Agency. This will be really solved. And we are very, very aware of this challenge. We cannot also, you know, put too much pressure of the countries for now. Now with the COVID, everybody is seeing that we really need to do that. With the COVID vaccines, it has happened. If you don't do that, we will not get the vaccine. So it will be something that will come to play very soon. Thank you.
I really like what you said, Benjamin, and I want to tell the international partners who do so much, who support the health systems globally, also to continue partnering with local SMEs and growing institutions in Africa that are trying to improve the quality of production and quality of manufacturing. I also have a question, a mention from Female Health Company, from Frederic, who's saying we should take more control. Yeah, you know, the Female Health Company has been trying to get the female condoms also into the space of Africa. So family planning, Benjamin, is going to be a big thing. Are we doubling our population by 2050 in Africa? And we double our population, we have youthful population, and if there's no gainful employment, then are we going to get the demographic dividends? Over to you.
That is a very interesting question. You know, personally, I see population, you know, has the first, you know, income of countries, but we really need to invest in these populations. That is where the demographic dividends need to really, we need to tap into the dividend. We need well-educated people in good health. Otherwise, you know, if that is not done, then being big in number will just create some chaos and troubles for member states. So we need, you know, women need to have, you know, the desired number of kids, and we should give them the opportunity, really. And the opportunity is through really, you know, using, you know, the protective measures, pills, and all those kind of things, really to get the number of the children.
The contraceptives. The contraceptives should be
the contraception is extremely
freely available, easily accessible.
Exactly.
Planning a family is better than having an unplanned family. So Africa needs to plan its growth.
Exactly.
Unplanned growth will take the gains away on our health system.
and the planning family should be, in the hands of the women. And this one is being we are moving in the right direction in terms of family planning on the continent, because we have all the frameworks in place. The Maputo Plan of Action is being very well implemented across the continent. We are seeing, some pushback here and there, but it is not very extensive, and we are moving into the right direction in terms of family planning on the continent. So yeah, we need to continue, and the issue sometimes is accessibility, and this is one of the commodities that we need really to produce on the continent, and it's coming also from outside. And everything that we are saying here is interlinked and interrelated. If you don't have the capacity to produce, then you have some challenges. I have seen in some rural Africa where the uptake of contraceptives is very good, but sometimes it is not the fault of the women, because there is stock out, and the replacement will take time. The chain of what is
the stocking and supply chain has
the
been
supply chain,
interrupted.
the supply chain, is not playing its role because of so many delays. That is a problem, and we have also the planning issues as well, and we need to strengthen capacity at all levels in the ministries of health. Those who are doing the planning, bringing these medicines, all those kind of things, they need to plan on time, to put the budgets in place on time. Those who are even in the facilities need to order in time, to not wait for the last pill to go out before ordering. And so it is really, we need to revolutionize the way we are doing things and we are working. Thank you.
Thank you. Reshma, you've raised RH isoimmunization to protect women and children. That's very clear. Whether there are priorities to set that, but also Mokadi is talking about the pandemic might have revealed unwanted, unintended teenage pregnancy. I don't know if we have a direct study and data, but anecdotal evidence and many feedback at different health events have shown that the emergence in pandemic didn't do well. In fact, it went backwards for unintended pregnancy. Yes. I'm sure that.
Yeah, yes, I don't have the data, the recent data about it, but the data in terms of gender-based violence has increased during the pandemic. And of course, you can see that it is a very good proxy, of impact of this pandemic on women and young girls in terms of unintended pregnancy, etc. So, yeah.
I think we are coming towards the close of our media briefing. Benjamin, the conversation itself was enlightening. From the people who are participating, who haven't logged off, I realized that they enjoyed this discussion. I also saw the engagement of partners and media very freely. I want to thank everybody for their time, their participation. I want to thank the Ministry of Health, Africa CDC, as our partners, all the sponsors and engagement partners and strategic partners. I want to thank you. Women's health is at the center, like Dr. Tedros said, on strengthening health systems in Africa. Benjamin, any parting shots before we close out?
No, mine is just to thank you and to thank all those who have really participated in this press briefing. We are looking forward to see you all in Nairobi, either physically or virtually. Thank you very much. Also, Amit, thank you to the team and all those who pulled this program together. Really, it was a wonderful one. Thank you.
Thank you, everybody, for your time, your engagement, and all the team members behind the scene to make this. Have a great day. We've come to the end of our media briefing. Take care, stay safe. Bye, everybody.
Recording
Thank you.
stopped.